I'll try to, I mix as much Tamil as possible, as much as I know. Okay. So badminton jump smash, as we've gone into the details of that, is probably the most potent shot in badminton, wherein the player almost flies through the air, meets the shuttle at a very, at a height, and then comes down onto the ground. So it's quite exciting, isn't it? Jump smash. It's exciting as well as dangerous. This is Wang Lin of China. This is in 2010, when Wang Lin was the world #1 at that time. And she was playing a tournament probably in Britain when this happened. She jumped, she lands buckles, and bad injury, really bad injury. Let's see what happens exactly. So she jumps, she hits a around the head smash, lands badly on a valgus knee, buckles and twists and falls. So valgus knee, one word for you to remember. I'll come back to that in detail later on. What happened exactly? What happened was she tore her ACL. ACL is anterocruciate ligament. It is it's like a chain in a bicycle. It holds the thigh bone with the leg bone, and as if when a chain is cut, when you lose control between the two tires, that's what happens. And it is especially susceptible to injury when the player is running, is on one leg, which is partially bent at the knee, and then the thigh rotates on the fixed knee. That is when the ACL is more susceptible to injury, and that is when it can get torn. That's what happened. She jumps, she lands on a partially bent knee, her leg is fixed, and she tore her ACL. So basically ACL or a chain madri irukku, rendu cycle tire naduve, when your thigh is fixed, when the leg is fixed and your thigh rotates, that's when, and it's basically a jaw. Okay, okay, ACL or a jaw, which can get torn when you're imbalanced and you're landing on one knee. Sorry for that. And jump smash is susceptible to injury. The various injuries which can happen during a jump smash, the most common amongst them are ankle injuries. You can get ankle sprains, and there are knee injuries. Knee has got ligaments and menisci which can get torn, and your heel cord may get damaged. There may be a sprain or a complete tear of your heel cord, which we call as Achilles tendon, and there can be other common muscle strains. So amongst these, most common is ankle sprain, but the most devastating is the knee ligament injury. So we'll concentrate our attention solely on that in my talk. So Wang Lin suffered that injury in 2010. She had to go off the field for 1 year. She underwent a surgery. She came back after 1 year and played. There are multiple players who got severe knee injuries who come back and played. Pullela Gopichand had a very bad injury in 1994, operated by Dr. Rajgopal. He came back and played again and won many major tournaments. So as Vimal sir pointed out, injuries are a part of badminton. You cannot avoid them completely. But yeah, you can avoid them to a certain extent, and you can come back from them. So we'll look into the causes of knee injury. Just look at the anatomy of the knee. Knee has got two shock absorbers called menisci. The ones which are pointed out in orange. Those are the shock absorbers, and they can get torn, and other things are the ligament. Ligaments are like ropes which hold the two bones together. So what happens when you suffer a knee injury? Mohan sir asked that, how to differentiate when to take the player off the field and when to let him play with painkillers and spray. As we all know, pain is the primary concern, as was pointed out. If the player says, I'm in a lot of pain, I'm not able to play, then take him off the field. B, if there is a lot of swelling and bruising, then that is an indication. And ligament injury is one special aspect in that way, in the sense that, as we can see here, I'll have some sound here. See, there's Wang Lin. This was after the injury. She took 5-10 minutes of rest, and she was able to play again. What do you think is the cause? Was she very mentally strong? Yeah, that is also there, but that is also related to the innate anatomy of the ACL. The ACL ligament ge romba blood supply kuda kadayadu, romba nerve supply kuda kadayadu. So when ACL ligament tears, then you generally have to do a surgery to reconstruct it. B, because it doesn't have much nerve supply, sometimes it may not be very painful. The player can go back and play his, he may feel that he may play his sports, but the giving away feature is instability. Kaal slip pagu. I'm not feeling stable in my knee. If the player feels that, then that is the sign that there is a severe ligament injury. And that is when you got to take the player off the field. So the point that I want to drive home here is some of the ligament injuries may not be very painful, but you got to look out for instability. If the player says, I'm unstable in the knee, if my knee is slipping, then that's a dangerous sign. You got to take him off the field. I don't want to go into the details of how to hit a jump smash. That has been dealt in detail. I just want to show you how to land, that's all. Okay, you got to have a wide base while you are landing, and there are two ways of landing. You can have a double leg landing and a single leg landing. There was a study in Beijing, China, which looked into the kind of landing that players are having, and it was found that right-hand dominant players were invariably landing on their left foot. About 78.9% people were landing on their left foot, and only 13% people were landing on their right foot. This is the right-hand dominant people. So a single leg landing is dangerous, as you could see in case of Wong Lin, but it is also unavoidable. Invariably, when you are against a strong opponent, you tend to land on one leg, so you got to have certain measures to prevent injury. Double feet landing is safer, but then again, single foot landing is unavoidable, because if you land on single feet, you can reach to a larger height and you can hit the shuttlecock at a more steeple angle. So how to avoid jump smash injury? Again, to reiterate the fact that it's important to land properly on your non-dominant leg first, then put your dominant leg down. We come back to the term called valgus landing. What exactly is valgus landing, as was pointed by Dr. Deepak? This is the normal knee where we have straight knees. If the knee is going out like this, this is varus knee. And if the knee is caving in like this, it's called valgus knee. So how do we know what is valgus knee? How do we remember what's valgus knee? When your knees are going in like this, okay, vulgar teriyuma. You know what's vulgar? When two objects go close, abnormally. When two knees are going close together, that's vulgar. What sounds like vulgar is valgus. So valgus landing is the one which is dangerous. And if your knees are going out like that, that's not so bad. And if they are straight, that's not so bad. Valgus landing is the one which is dangerous. So this is a study that we've done. You see the picture, movie on the left. When the player jumps up and lands, her knees are caving in. This is valgus landing, and this is what makes a player prone to injury. In contrast to that, this is normal landing. When the player goes up, and lands, then the knees are straight. So a valgus landing is dangerous, where you got to have a straight or a varus landing when you jump and land. So this is what happened. She landed on a valgus knee, twisted, and tore her ACL. So beware of the valgus landing. All of you today, maybe coaches, you see your wards jumping in front of you and landing. See whether they are landing in valgus. If they are landing in valgus, then that's a dangerous situation. As players go back home, jump in front of mirror. See how you are landing, whether you are landing in valgus or how your knees are when you are landing. So varus landing, idu nalladhu. Valgus landing. This is a dangerous situation. So, is it really bad to have valgus landing? Can it not be corrected? Yes, it can be easily corrected. Basically, if you're having valgus landing, that means some of your muscles on the inside of your thighs are stronger than the muscles on your outside of the thigh. So you got to do certain exercises on your hip, on your thigh muscles, on your leg muscles, and it can be corrected. These are certain exercises to correct them. just a few of them, and certain ankle exercises to correct them. So we've learned you got to correct your valgus landing to prevent injury, other general measures to prevent landing, prevent injury, proper warm-up, proper cool-down, and proper stretching. So in a major event, you got to have at least 30 minutes of warm-up and 30 minutes of cool-down. All of our players know that. Yes, sir, we know warm-up is important. But when we tell them that you got to cool down for 30 minutes, this is what they'll have on their faces. Half of our players know that it's important to warm up and cool down, but they don't do it. And the other half probably don't know it. So warm up is important. All of us know that. Cooling down is equally important. You got to have proper strength to prevent injuries. And what happens is the ligaments are the restraints against motion. So in case your muscles are not strong enough, then all the load falls on your ligament. So the ligament is a little overloaded and it is susceptible to injury. If you have proper strength in the muscles, then the ligaments are not so overloaded and there is less chance of injury. Just recap, jump shot is dangerous once in a while, and probably the career and ending injuries happen during jump shot. What are the preventable causes? Valgus landing, pronated foot. Foot problems are also important, but it may result in ankle sprains which are not that dangerous. Proper warm-up and cool-down has to be done, and you got to have a proper strength. So take-home message from me, mind it. Get your basics right. Correct technique of splashing, as Dr. Jayant pointed out, is very important. If you don't have the correct technique, then you'll land badly and you're susceptible to injury. Proper warm-up, pre-event stretch, post-event stretch, and proper cool-down is very important. It's important to strengthen yourself in the gym, which is coming up in a big way these days. Proper landing and jumping and landing drills have to be practiced. You got to wear proper equipment. If you don't wear a proper shoe, if you're not having a proper racket, you're susceptible to injury. Be careful when you're tired, and especially when you're landing on the single leg. There are greater chances of injury. Don't continue after a major injury. As I showed you, some of the ligament injuries may not be painful, but you're having instability, then come out of the field. Always take an expert help and advice. Remember the dangerous valgus landing. Thank you.
Thank you, Dr.